Alright, we're continuing our discussion about numbers, and we're going to be talking about blood pressure. Blood pressure takes on a lot of significance in midlife and elderly patients. And the question is, how important is it? And what's the ideal blood pressure? Everyone thinks this is the ideal blood pressure, 120/80. All my patients, when they have 120/80, leave here very happy. But think about how we do blood pressure. We use this Velcro machine from probably about 1900 is when it was invented. No improvements on this. We put it on someone's arm. They're already nervous as soon as I put this on the arm, and the blood pressure is already starting to climb.
Yeah.
And then we pump it up.
Right. Okay.
And we check the blood pressure that way.
Okay.
Now, if I did this blood pressure 4 times during a visit, I'd get 4 completely different numbers. If I do it later today, I'll get a different number. If I do it standing, sitting, I'll get a different number. So it's not an accurate machine, and there have been a lot of studies showing us this. And yet when we take your blood pressure, we make huge decisions based on that one number for that 1 second. But just how important is the number anyway? There was a big study that came out called the Shep study that looked at elderly people and found the pressure above 160 is actually dangerous, can increase the risk of stroke and heart attack. But how much does it increase the risk? And it turns out not very much. And the older you get, the less the increased risk is. Even more than that, once you get below 160, there is no increased risk. So the idea of lowering the blood pressure to 120/80 is not an idea that has any basis in science. Once you get below 160, then you're okay. In fact, new studies have shown that in elderly people who have had heart attacks and strokes, if you get the blood pressure below 120, you start increasing the risk of stroke and heart attack. So we're actually doing more damage by treating blood pressure aggressively. Even more important in the elderly, the lower you push the blood pressure, the more likely they are to fall, to be tired, to be confused, and to not function well. They actually do much worse at lower blood pressures. The medicines we use for blood pressure all have side effects, and they all interact with each other. And sometimes an old body needs high blood pressure. Once the blood vessels start to narrow, the body actually increases the blood pressure for a good reason. It's trying to get the blood through those vessels. And we come along and throw medicine at these people, lowering the blood pressure, causing the body to work to raise it again, and just create chaos within the body. So we're actually doing a lot of damage by overtreating blood pressure. So blood pressure is a number with a lot less significance than people realize. But actually the significance comes in how much we overtreat it. Medicare's guidelines have us treat blood pressure fairly aggressively, although those guidelines are becoming more sensible in the recent past. So this number that everyone's excited about, forget it.